Hey, if you're thinking about becoming a home healthcare nurse, but you're wondering about what kind of skills do I need? Well, we're here with Ali from Norwill, and he would know better than anybody. What kind of skills are required to become a home healthcare nurse?
Well, off rip, the basic stuff is compassion. It helps, of course. We talk about
sure.
that. Other things are pretty basic stuff. I mean, going in the door, like I said earlier, you can learn to be a nurse. You can learn a skill of being a nurse. You can, know how to take the temperatures, know how to change the bandages, know how to instruct. There's a lot of instructing. Being able to be a people person, that's a basic skill. Honestly, It's a very important skill to have. You don't become a nurse to necessarily just want to be locked in a room somewhere. It happens more and more than you think nowadays, actually. Like I said, with telehealth and things like that.
Yeah, right.
But the idea is that however you are, you come across or come to that point, the biggest thing you want to be is helpful. You can't learn that. You know what I mean? You can learn how to do things, but you can't necessarily learn the motivation behind it. And so those are basic stuff. Everything else is practical stuff that you will learn, or skill stuff that you'll learn in the courses that's offered. Like I said, learning how to do bandage changes, stuff, learning how to do the assessments.
Mm-hmm.
There's a real skill in knowing how to do an assessment, for a patient coming in into a facility or for home care, because there's a lot of information that has to go through there, and you have to ask the right questions. You got to be able to know how to read the orders. You got to know how to know the diagnosis codes and all those kind of things, And so, other than that, I think it's knowing how to read, of course, knowing how to write. Those are basic stuff. Knowing computers, that's basic stuff. But everything else, and depending on the genre that you're going into, home healthcare is a little bit more administrative in certain respects when it comes to healthcare. As far as home non-medical, our nurses, the LPN, goes out and does the assessment sometimes under the care of a RN. But for the most part, they're supervisors of the aides, and along with our non-medical, we call them care managers. And so they make sure the aides are where they got to be, doing what they got to do. They go and check on the clients, make sure they don't need anything. So they do most of the reassessments and assessments and things like that, and answer some of the tough questions that need to be asked. And then if there's some more. And our RNs are really pretty much more of administrative for the most part, and they are pretty much working with the assessments straightforward. Because they can go deeper. Like I said, knowing the administrative codes and all that kind of stuff, knowing the RX codes and all that, knowing how to read the orders from the doctor, if those are things that need to be, done, had conversations with the hospitals and facilities and things like that to make sure those things are done. And the skill is just that. It's way more skill depending on the discipline that you're in. You may be doing wound care, you may be doing IV medications, you may be doing med boxes. In home care, for example, a lot of the LPNs do a lot of the med management types of things like that. And the nurses may do more, again, the RNs do a lot of more administrative stuff, but some hands-on things that may need to be able to be done, have to be done, like I said, wound care, IV medications, and like they say, anything above the neck, if there's some things that need to be done, the RNs is skilled enough to be able to do those types of things. And everything has a priority. I mean, the doctors, nurses, LPNs, aides.
But they all work together as well. And we've done some other videos today. And if you're not on the website at norwillhcs.com, check it out, because there's a lot of things that Ali shares about what it's like, getting into this business and some of the rewards of it and how everybody works together. And it's He's been doing this a while and doing it pretty well. So if you're looking to get into this and you're wondering what kind of skills, well, if you have some empathy, as you said, that's number one, and there's some other things you can learn as you get in. So be sure to check it out, norwillhcs.com.